My name is Annabel Mackenzie. I am a shiatsu therapist in Vancouver, Canada, and I am an instructor with the Barral Institute. I'm going to say a few words about the Visceral 2 class, and it is a wonderful class that builds on the skills that you already have learned in the Visceral 1 curriculum. We divide this class into 2 days. The first 2 days we will present to you new anatomy, and we will learn the anatomy of the retroperitoneal organs, being the kidneys and the pancreas. We will also present the anatomy and techniques for the spleen, and for the greater omentum and the parietal peritoneum, we have a lab for each of those fascinating structures, which have a lot of intelligence in them. We will be looking at their nerve supply, vagus nerve, phrenic nerve, and how they serve to protect the body in a case of a trauma or a surgical intervention, and looking at resolving some of those things that arise. The second 2 days will be building on skills that you already have from Visceral 1, and we will be treating organs in relationship to each other, and also treating them in relationship to the body. So how do really the organs that suspend from the diaphragm relate more specifically to the diaphragm? So particularly for the liver, we'll be looking at the left and right triangular ligaments, so getting a little more specific with our listening and getting a much more specific results because of the specificity that we're bringing. And also we are going to present the stomach in relationship to hiatal hernia, a very common problem that comes into our offices. So that's a very wonderful thing to learn. So really it's a lot of looking at relationship in the body and problem solving. So we have a lot of freedom and time to relax with the work and really integrate the practical application. Myself, in my practice, I work mostly with people who need their body for work. I work a lot with performing artists, I work with dentists, and I work with carpenters, someone where it matters for their work if their body moves. And I really find that the visceral helps them so much to really get back to work faster, and it is just an introduction to the lifelong wonderful results that you can get from including more anatomy than just the muscles and the bones in your wanting to help your patients.